So you do have a tongue right here within that mouth or oral cavity. All right, you can see it here on that sagittal head view. Take a look right above the tongue. See right through here? That's bone. That's the hard palate. Y'all have probably seen the hard palate before because you talk about the bones that make it up in A&P1. The palatine process of the maxilla and the two palatine bones. All right, so you have the hard palate right through here. As you continue back, notice the hard palate, the bone goes away, but right about in this area here, you get muscle surrounded by some mucous membrane, maybe a little bit of adipose tissue. This is the soft palate. The soft palate. Obviously, it's soft because there is no muscle. No bone. Excuse me. This downward projection of the soft palate right through here, this is called the uvula. The uvula is important because here's a little bit about how you swallow. Y'all don't have to know the swallowing or deglutition reflex for this course, the lab, but in the lecture you may. When you swallow, your tongue goes up. It makes contact with the hard palate. Whatever is in the oral cavity then is pushed posteriorly. At the same time that the tongue goes up, the soft palate, the muscle here elevates. It goes upward. This opens the entryway into the pharynx, allowing whatever you swallow to begin to slide posteriorly. The uvula, the importance of it is that it directs whatever you swallow to move inferiorly, downward. If the uvula was not there, it could go up. You don't want it to go up. That's where your nose is, okay? You don't move what you swallow and just into your nose. You want it to move inferiorly toward your stomach and the small intestine for digestion and absorption. So the uvula directs it inferiorly, and then it continues to move, all right? So the uvula and the soft palate are essential in your ability to swallow. You actually develop the control of that within days of being born. Not even days, really like damn near hours. Because if you don't learn how to control that, you can't nurse, you can't drink milk. I mean, when a baby suckles, it learns how to control that swallowing reflex. In fact, if you guys, I don't know who's in, some of y'all in nursing, interested in nursing, right? Mm-hmm. If you ever want to do like a NICU rotation with the little premature infants, one of the things they have to really work with them on is how to nurse, because like they don't naturally have that reflex develop as quickly. So in order for them to leave the NICU, they have to figure it out. So it takes a little bit more time. All right, anyways, as you move next into the pharynx is a funnel-shaped tube. Funnel-shaped because it starts out wide at the very top, which is up here, and it narrows as you move inferiorly. There are three sections or regions to this pharynx. If they're nice to you on the practical and they ask you to identify one of these regions, they will say, identify this region of the throat. Think in the lead-in, I told you, the pharynx anatomically is equivalent to your throat. So if they're saying that, they're looking for one of these next three items that I'm about to give you. Behind the nose or nasal cavity, you will have the nasopharynx in this area here. It's the nasopharynx. It's the space at the back of the nasal cavity. Behind the mouth, you'll have the oropharynx, taking that name from oral cavity. And then this little piece of cartilage right here, that's the epiglottis. It's part of what we call your larynx or your voice box. It's a respiratory system structure that you'll see next week. But at the back of the larynx, you have the laryngopharynx, nasopharynx, oropharynx, laryngopharynx. It would ask you to identify the region of the throat. Now, in the naso and oropharynx, there are structures that you guys want to be aware of. We'll start with this opening right here, which is within the nasopharynx. This is the opening of the auditory tube. The opening of the auditory tube. If you've ever had the sensation of your ears, quote unquote, popping, that's the structure that is most likely the culprit behind it. Take a flight, go on an airplane. What they do is prior to takeoff, they pressurize the cabin. They pump a lot of air in so you can breathe easy. But as they pump that air in, it enters your middle ear, and so much air pressure builds up there that your tympanic membrane can't move easily. That's why if you sit next to somebody on a flight and they start talking, you like, it's hard to hear them. Have y'all ever had that experience before? Well, what do they say? Drink some water or, chew gum or whatever, yawn. All of that changes the angle of your auditory canal, allowing some of that air to escape. When the air escapes, the eardrum snaps back into place and you feel like your ears, quote unquote, popped. So that's the opening of the auditory canal right here. Right here, the very posterior aspect of the nasopharynx, you have the pharyngeal tonsil. Pharyngeal tonsil. This is one of 3 sets of tonsils. Collectively, they help protect you from inhaled or swallowed pathogens. So as you inhale air, it will move this way. Any particular microbes or pathogens within there, maybe this tonsil helps filter them out. All right? So you have the pharyngeal tonsil here. As we move now into the oral cavity, I already showed you the uvula and the soft palate. But you do have the second of the tonsils, which is kind of this light pinkish circular structure here. That is the palatine tonsil. There's 2 of them actually on either side of the uvula within the oral cavity, the palatine tonsils. These are likely to be inflamed if an individual has pharyngitis. Pharyngitis is just inflammation of the pharynx. It can be viral or bacterial in nature. If it's bacterial, usually it has a very distinctive appearance. We say the tonsils, the palatine tonsils, look angry because they turn bright red. And usually they also have these little pussy, what they call exudates on the surface as well. So if you ever clinically have to look at somebody who has bacterial pharyngitis, it is pretty damn demonstrative. Red, angry looking palatine tonsils with yellow oozing material on top. So at the base of the tongue, almost looking like a little tail hanging off the tongue, this is the lingual tonsil. Again, forming a ring. Pharyngeal, palatine, lingual tonsils, protecting you from inhaled or swallowed pathogens. All right? As you move from the pharynx, you're going to next hit the esophagus, which is here. This should be a very easy structure to identify. If for some reason I tag esophagus on the test, this should be like a layup. All right, this should be something easy. But flat muscular tube that will travel through the mediastinum and connect to the stomach within the abdomen. But remember earlier I mentioned to you sphincters, right? They're in between each section. There's actually one between the pharynx and the esophagus, but it's not on the model, so we don't talk about it. It's called the upper esophageal sphincter. But here at the bottom of the esophagus, you're going to find the first sphincter that I do believe you are responsible for. It's called the lower esophageal sphincter. Now, on this model, the sphincters all have a pattern that they are presented with, and it works like this. You will see muscle, space, muscle. Muscle, space, muscle. That's the pattern for every sphincter. Because a sphincter is a band of muscle. Y'all know what a rubber band looks like, right? It's like a circle. But on the model, they cut it. So when you cut it like this, you get muscle, space, muscle. And that's why the sphincters look like that on the, somebody wants to talk to you. But no, muscle, space, muscle is how those sphincters look. This is the lower esophageal sphincter. In your structures list, you may also see a different term. I don't use that one. I call it lower esophageal sphincter, but you may also run into cardioesophageal sphincter or cardiac sphincter. They're taking the name in that situation from the first section of the stomach. That's not what I was taught when I was learning anatomy. I know it's acceptable, so if you want to call it that, that's fine, but I will always refer to it as the lower esophageal sphincter. All right, go to the stomach. We look at the stomach, this first little section right through here, I'm going to kind of go back and forth over it like that with the pointer. This is the cardia, You see how once you get past the lower esophageal sphincter here, how the wall curves backwards? It would also curve forward. You can kind of see that happening here on the model. See how we go both directions? That little area that receives the incoming, what's called a bolus. A bolus is a food ball. That's what you swallow. You ball it up and then you swallow it. It's a bolus at that point. What receives that bolus, that little area is the cardia. That's where the term cardiac sphincter comes from, or cardioesophageal. Because the cardia is this first little section of the stomach right here, okay? It's where you receive the bolus as it enters. Next, I'm gonna put the pointer like this, if I can get this balance right. Nope, it's not gonna work. But this little area, this dome-shaped area off to the left-hand side, this is the fundus of the stomach in this area here. Again, use the questions on the test to help clue you in as to what you need to identify. It will say, identify this region of the entire organ, include the organ name. The reason that you would have to say fundus of the stomach is because the uterus, which is a reproductive organ in the female, also has a fundus. So again, they're trying to see, do you know which one of these organs you're actually looking at? The fundus, at least the only one y'all have in this test, is part of the stomach. Reproductive doesn't come up until exam 3. If we drop a line from here, where we have the fundus and the cardia, and come all the way to this bend, between the 2 pointers now and here, this is the body of the stomach. It's the largest section, and again, you want to read the question because it will say, identify this region of the organ. Because as you can see, these little raised areas, that ain't a region. The raised area or the ridge is called a rugae. Ruga is singular, rugae is plural. The rugae allow for the stomach to stretch or expand when you ingest a meal. So they're folds that allow the walls of the stomach to stretch. So again, you got to use the questioning. Identify this region, body. Identify the raised area or the ridge, rugae. All right, the question is going to point you in the correct direction. Lastly, we have the area between the 2 pointers now. This is called the pyloric region. The pyloric region. It starts as a wider area called the pyloric antrum. And then as you move toward the terminal aspect, it narrows just slightly, and you have the pyloric canal. So the pyloric antrum is the initial section. The pyloric canal is where we're ending. The opening at the very end of the stomach, right where the pointer is here, that is the pylorus. The pylorus is literally the hole at the end. Around the pylorus, you will find a sphincter. Watch. Muscle, space, in this case we called it the pylorus, muscle. Told you all the sphincters are cut, right? Muscle, space, muscle. This is the pyloric sphincter. Pyloric sphincter. All right. You have 2 curvatures to the stomach. The greater curvature has a much more obtuse angle. The lesser curvature has a more acute angle. So I know that goes to math. Honestly, I can't define obtuse and acute for y'all because I'm not a mathematician. I just know obtuse means a wider angle. Acute means a much sharper or narrower angle. And look at this. This has a much wider angle. This is real more acute. I don't know how else to describe it. That's the best I can do. So the last part to the stomach, you actually need to use one of these models to deal with it. And this goes back to the layers of the GI tract wall, which I will kind of quickly use this model to show you. This model is actually a model of the small intestine, but it can show you the 1, 2, 3, 4 layers to the wall of the GI tract. All sections, whether it's esophagus, stomach, small or large intestine, are considered to have these 4 layers. We start with the mucosa. This is the mucosa of the small intestine. It's got epithelial tissue and some other items. I don't go all the way with that one today, but again, use your lab manual, use your textbook. You should be able to walk through that. I do have a labeled version of this in my PowerPoint. You have the submucosa right through here. The submucosa has connective tissue and blood vessels to support the epithelial tissue here in the mucosa. But deep to that, you have the muscularis. The muscularis in most locations has 2 layers. You have a circular layer, which they kind of nicely have circular shapes in the circular layer. And then you have a longitudinal layer, which runs the length. So we go like this, the length-wise. Circular and longitudinal. But in the stomach, there's a 3rd layer to the muscularis called the oblique layer. So it's not on this model, because this ain't the stomach. This is the small intestine. The serosa is actually a thin yellow line at the bottom. It's like a capsule that sits on top. All right. Mucosa, submucosa, circular muscularis, longitudinal muscularis, serosa at the very bottom. Why did I pull out these? Because on these models, they want you guys to be able to identify all 3 layers to the muscularis. And in order to do so, you need to look very closely at the fiber direction. If you get up close on these models, you will notice that one set of fibers goes like this. That's the length. This is longitudinal. It will be the most superficial. They'll start to cut away and notice that the fiber direction changes. See how they're going up and down like you could wrap them around? This is the circular muscularis. And then you get a third window cut away because the deepest muscularis layer is the oblique layer. It looks like it might be longitudinal, but trust me, it does run more so on an angle, all right? It is like it's not a straight, it's not lengthwise, it kind of makes an angle. I don't know how else to describe it. Longitudinal, circular, oblique muscularis of the stomach. You can do it on this model as well. It's a little more difficult. I'm gonna let y'all try it, but if you get really up close, you'll see that the red fibers have different directions. See here versus here? See the different directions? That's what you're using to determine circular versus longitudinal versus oblique, all right? So this one's easier to show because it's just white fibers running. This is a little more difficult, but you can do it here. All right, that was the last concept on the stomach, all right? Because I had to